Question number 6. So A, part 1. State the meaning of the abbreviation CPR. So CPR stands for cardiopulmonary resuscitation. 1 mark. Number 2. List 3 steps involved in performing CPR. Now, they didn't say to list it in order. They didn't ask you to list all of the steps, just any 3 in any order that you could remember. You put that down and you'll get 1 mark for each that you put. So I just put it in order and I put all of the steps. So 1, check the scene and the victim to see if there is a response and to make sure that the area is safe. So there isn't any glass or nails or any sort of sharp objects that could cause harm to you while you are trying to help the victim. Number 2, call the emergency services for help before you even think about starting CPR. So they will ask you questions that they are trained to ask to assess the situation. They will ask you if you can administer CPR, that you know how long they will take to get there, and all of the necessary information that you have to before you even think about starting it. Now, if you do have to do CPR, then we go on to number 3. So tilt the victim's head back and lift the chin. This clears the airway and you are checking for breathing before you start doing it. Then you know your hands are supposed to be in a specific placement or pattern. You give the chest compressions as well as breaths. So 30 compressions, you have to count that, keep count, and 2 breaths. Then number 5, you continue CPR until the victim either responds or help arrives. So the victim cannot respond now and then you tell them, wait here and continue doing CPR on them. If they respond, is whichever comes first. The victim responds or help arrives. Either way, at either point, that is where you will stop administering CPR. Then number 3, outline 2 precautions that should be taken when administering CPR. So that very first one, ensuring that the scene is safe, so that while you are trying to be a good Samaritan, you don't end up being harmed in while trying to help. Number 2, use personal protection such as rescue mask or gloves if it is available. Number 3, use proper techniques. So you don't want to be wasting your time thinking that you are doing the right thing when in fact you are causing more harm to the victim. And number 4, call for help before starting the process to estimate how to pace yourself and to know if you do have the ability to do it. Because you don't want to start, once you start CPR, you cannot stop, or you should not stop. So you need to make sure that the help is on its way and it is at a or within a particular time frame, knowing yourself and being honest that you can continue administering the process until such help arrives. Then you have part B. So table 2 shows the heart rate of 3 persons before exercise and then 1 minute after exercise. So each person completed the exercise activities at different intensities. So you have person A, B, and C. They didn't tell you who did it at what, but what you have is the before and the after. So 1, identify which participant performed exercise at the lowest intensity and provide a reason for your answer. So from the from the before and after heart rates, this could give you a peek into who had it at the lowest or who had it at the highest intensity. So from the answer, I would say that person A performed it at the lowest intensity. More so because you're looking at the after and before to see the difference between it. So they had the least increase in their heart rate after exercise. And remember, this is after 1 minute. Then 2, state one conclusion which can be made from the data shown in table 2. Simple. What are you seeing here? Exercise causes an increase in your heart rate, right? So very simply put, Or you can also say the lower the intensity, the or the lower the intensity, the easier it is, or the less time it takes for your heart rate to get back to its normal resting state, or the higher the activity, the longer it takes for your heart rate to get back to its resting state. Anything like that, just one conclusion. And part three lists four possible benefits of exercise based on your conclusion stated in B. So I stated that exercise can cause an increase in heart rate. So what's a benefit, or what are four benefits of having an increased heart rate? Well, one, it improves blood circulation. Two, it strengthens the heart muscle. Three, it burns calories and reduces fat. And this is why we do cardio, to try and lose weight when we are exercising, because it burns that energy. Sorry, it burns fat or the glucose that you have stored, which after that is burnt out, then you start breaking down stored fat. And finally, it removes waste products faster. Because, for example, remember, urea is one of the waste products that is um, released into your blood. If your heart rate is faster, meaning that your blood is circulating faster, remember, every time your blood circulates, it is filtered through the kidneys. So therefore, we could remove waste products, for example, from the excretory system at a faster rate. So this is the last question of this paper. As usual, if you have any questions or anything that you didn't understand on any parts of these videos, please feel free to leave a comment and I will get back to you as soon as I can.